want to welcome everyone this afternoon to the first press conference for the Miami County Heroin Coalition. My name is Steve Justice, and I am the facilitator for the Miami County Coalition. I want to give you a little background as to the coalition and how it formed and what we are doing, and then give you an opportunity to ask any questions that you may have. I previously issued to you a written press release, which in substance will be a lot of the same things I'm going to tell you today. So if I have to leave something out, please refer to the full press release. Our coalition began meeting in January of 2016. It came about through the effort of some of the people who are seated here in front of you. Our coalition members are a combination of Miami County and municipal government officials and public service providers, as well as faith-based representatives. The list is long. It includes the Ohio Attorney General's opiate task force, the common pleas, as well as municipal court, drug court judges, the juvenile court judge, the adult probation, Miami County prosecutor, the Ohio State Highway Patrol, the Miami County Sheriff's Office, the Piqua Police, Tip City Police, Troy Police, the Troy Fire Department, the Tri-County Board of Recovery and Mental Health Services, the Miami County Recovery Council, Recovery and Wellness, the Upper Valley Medical Center, Samaritan Behavioral Health, Care Source, Families of Addicts, New Creations Counseling Center, Hope Over Heroin, and over 40 churches throughout Miami County. Approximately 40 people have been meeting together on a monthly basis since January. Early on, we decided to break up our coalition and its work into 4 subcommittees. These committees were formed on the basis of tasks, of work that we felt needed to be addressed in order to address the heroin epidemic in our community. I call it an epidemic. Some have called it a plague. The reality is that in Miami County today, approximately 50 people per month are overdosing on heroin or opiates. Even in the last week here in Troy, we've had someone overdose in the bathroom at Walgreens, in the bathroom at McDonald's, and we've had 2 people who died, ages 27 and 31, in Piqua, just in the last week from suspected heroin overdoses. This is not the normal situation for any of our communities. It's really unprecedented. We are a county of 100,000 people, and to have something like this, a plague of this magnitude affecting all of us, is just unprecedented. So because of that great need, we got together as community leaders and said, what can we do? We formed 4 committees. The Safe Harbor Committee was the first one. It's comprised of our first responders, our police, our law enforcement, our fire and EMS services. We formed also the Medical Support Committee, which is comprised of people who are doctors, nurses, others who are affiliated with the medical aspects of this particular disease. We also formed the Education and Prevention Subcommittee, which is designed to address education of not just young people, but of the community and adults at large, and preventative measures to stop persons from even engaging in the use of opiates or other addictive drugs. And finally, we decided to form a faith-based committee and to expressly invite churches and parachurch ministries into our effort, because we all have found that one of the great ways to defeat this particular plague in our community and in any community is to provide a way for people who are suffering with this particular calamity to connect with other people. And churches are a proven and successful method for people to connect and to find a road to wholeness and to healing. So it's a combined private and public effort. I have in front of me just a few of the members of our coalition, and I want to introduce them to you today. The Fire Chief of Troy, Matt Simmons, is here. He and I were among the first 2 people who sat down and discussed the possibility of forming this coalition. Paula Dietrich is with us today from Families of Addicts, which is a phenomenal organization that started in Montgomery County and last night launched its first chapter meeting in Piqua for all of Miami County. It's comprised of family members as well as addicts who are in recovery, and it's designed to reach a segment of this plague that often is left out. Sometimes family members feel vilified in having to deal with this. They're placed in situations that no person should be placed in, really. And so we're excited to have families of addicts up and running here. Tom Grimm is with the Miami County Recovery Council, which is one of the leading addiction treatment centers here in Miami County. Aaron Simmons is the senior pastor of the Upper Room Church in Tip City. He's also leading our Hope Over Heroin event effort, which I will talk about more, and he will in a little while, which is being held on July 8th and 9th here at the Miami County Fairgrounds. He's also a fireman and a father of 4, and his wife still loves him, so he's a busy man. Mark McDaniel is to my far left over here. Mark is the director of the Tri-County Board of Recovery and Mental Health Services, which is a significant overarching agency directing funding as well as oversight for community outreach and treatment for addiction-type services. In the back row, we have Dave Norman, who is running our county jail, which at this point is the largest detox facility in Miami County, is our county jail. It is the only detox facility that we have in Miami County presently. We have Brad Reed in the back, who works with Mark McDaniel at the Tri-County Board, and Brad works in community outreach efforts and has been very integral to our Education and Prevention Committee. We have Ian Montgomery, who also works at the Tri-County Board and has also been working in our Education and Prevention Committee. And then we have Steve Lord, who's with the Miami County Sheriff's Office and has also been intimately involved in all aspects of our coalition work. I'd like to talk to you a little about what we have accomplished in the first 5 months that we have been in existence. One of the things we realized at the outset was that no one had ever actually put together a comprehensive resource guide which listed all of the addiction and counseling services that were available to residents of Miami County. And so one of the things that an addict or a family member will ask is, where can I go? What can I do? And to just be able to have a resource to hand them, which can give them some information, seemed to be so very important to all of us. So with the help of many of the members who are sitting here before you now, we put together a beautiful resource brochure. And it provides, in multicolored fashion, on 2 sides, all of the addiction and counseling resources available, not just to the citizens of Miami County, but also to Darke County and to Shelby County. So it's a 3-county resource. And we were able to, with the help of CareSource, which is a member of our coalition, to get these printed, 5,000 copies CareSource printed at no expense to the coalition. So we have some copies up here in front. If you want to take one, you're welcome to. But our first responders and really all of our coalition members are actively handing this out now to family members, to those who have informational needs, to addicts, those who want to connect to some treatment. The second thing that we did was we asked our medical support committee to structure for us the ideal system of care for an addict who's suffering with opiate addiction. And they put together a flow chart which basically starts with the intake of an addict who's seeking treatment, goes through all of the process, and at the bottom of it, through the flow chart, is where they come out hopefully set free and broken from the chains of addiction. We set this up to guide us from the outset. The purpose was, this is our target. And where do we have holes? Where do we need help? What do we lack in Miami County? Opiate addiction is not something that stops and starts at the borders of Miami County. As you know, Senator Portman in his ads has indicated that over 25 people are dying every day in Ohio from opiate disease, so and from addiction, and so it's something that's plaguing the entire state and the region. And but yet we are here, and we wanted to see what we needed to do here in Miami County. So we completed that, and I have copies of that for you as well up front if you'd like to. And in the process of doing that, we found that we needed to address certain aspects of our flow of care. And that's what we've been aiming to do. One of those was to try to increase the capacity to administer Narcan to addicts. Those people who overdose can be administered Narcan to revive them. And so the Miami County Sheriff's Office took a dramatic step of having all of their officers trained so that they could administer Narcan to someone who overdoses on heroin. In rural settings throughout Miami County, the Sheriff's Office is often the first responder to arrive as opposed to EMS. In a lot of our municipal settings, the fire or EMS will arrive first. But in rural settings, that's not always the case. And when someone has stopped breathing, time is significant. So the Sheriff's Department recently finished training all their deputies, and now all of their cruisers, when they go out, have Narcan kits in them, and they are prepared and ready to administer Narcan to anyone who's suffering an opiate overdose and who has stopped breathing. The fourth thing that we did as a coalition was we found out that we do not have any providers of Suboxone treatment in Miami County at all. Zero. Suboxone is a drug that is used to help patients in the withdrawal phase from opiate addiction. And it helps to treat their symptoms so that they don't endure the pain and agony that would otherwise be associated with withdrawal from opiate addiction. We have no doctors that are currently licensed to prescribe that in Miami County. So if a citizen in Miami County wants medically assisted treatment during the withdrawal phase, they end up having to go to another county in order to receive that. Sometimes that geographic distance is a significant barrier in and of itself to receiving treatment. So with the help of Upper Valley Medical Center and the Upper Valley Foundation, the Upper Valley Medical Center and Samaritan Behavioral Health sponsored a CME for doctors on May the 24th of this year, just a couple of weeks ago. Over 820 doctors were invited to attend that CME, which was held at the physician's office building at UVMC. Approximately 15 medical providers came and attended that event. One of them immediately thereafter agreed to go ahead and take the licensing training in order to become licensed to prescribe Suboxone. The way the regulations are currently written, a doctor who receives their license can treat 30 patients the first year and 100 patients in subsequent years. So it's a limited number, and you have to take a special licensing course in order to be able to prescribe it. One doctor volunteered immediately, and we're currently following up on the other medical professionals who attended that CME to see if more of them will agree to be trained so that we can actually provide that sort of medically assisted treatment through Suboxone here in Miami County. The fifth thing that our coalition has accomplished is through our faith-based committee, we have sponsored and have set up what is going to happen on July 8th and 9th, the Hope Over Heroin event. I'm going to have Aaron Simmons talk about that more in just a moment, but we anticipate that to be a significant event for the entire Miami County community. We hope that 5,000 to 10,000 people will attend over that two-day faith-based event, and we hope to see a lot of people who will sign up to get treatment and will begin the road to recovery from opiate addiction. Finally, currently some of our first responders, police, fire, and addiction treatment specialists, are considering implementing a pilot project this fall called the Quick Response Team. Colerain Township has been using this particular paradigm for the last year and has seen a significant number of reduction of overdoses as well as related crime. The idea basically is that a police officer, a fire EMS person, and an addiction treatment specialist, the three of them, will go out and visit someone who has overdosed and been Narcaned within 48 to 72 hours after they have received Narcan. The purpose is not investigatory. It is to go in to see if that person is, since they almost just died, is interested in receiving treatment. And they have found that typically 4 out of 5 people that they have followed up with decide that they want to enter into some type of treatment. So it's a cooperative effort between police, fire, and addiction treatment, but we think it's worth a pilot project in Miami County, and we're currently exploring that with some of the municipalities to see if one of them will be willing to take that on as a pilot project to introduce this fall. So 5 months, 6 big things. One more finger up. We're excited for the progress that we've made. I now want to allow Aaron, if you would, to come up and talk to us briefly about the Hope Over Heroin event and give some more details. Then we'll open it up for any questions that you may have.
We're excited to bring Hope Over Heroin to Miami County. It will be the first time in Miami County for this event. It has been in Montgomery County 2 previous years, 2014 and 2015. Hope Over Heroin was started in the Cincinnati area. It's a nonprofit organization that basically 3 pastors faced in their area 14 deaths in 1 week to heroin overdose. So they launched this. It's an open air event, and it has now had 9 events, mostly throughout Ohio, and we will be the first one of this season. So it is July 8th and 9th at the Miami County Fairgrounds. Friday night will be 7 p.m., open air event, live music, And Saturday, the event starts at noon. There will be food, games, jumpies for the kids. It's family friendly. We'll then be doing a memorial and prayer march throughout somewhere within reasonable walking distance of the fairgrounds, and then open air event again at 7 p.m. Saturday night. The focus of the event is really to lead addicts and the hurting to freedom. It's also to have a memorial and remember those who have passed away, and also offer assistance to families and those who have been affected by the addictions. So it's the faith-based, the churches coming together, as well as the non-faith-based, mental health, recovery services, medical services, and those that can provide help. We're coming together in a collaborative effort to launch, be a launch pad really for the community to face this epidemic. So we're really excited for it. We know there's going to be thousands of people, and we know there's going to be a lot of people led to freedom. The hurting will be made whole, and so we're just really excited. Are you ready for questions, or does that give you a synopsis?
Bruce Jameson just joined us, by the way. Bruce, come on up. I'm going to pull a chair up for you. He's on our coalition with the Chief of Police.
But to finish about the Hope Over Heroin, as he comes up, it's not just for the addicted, it's for the families that have been affected by it, but also honoring and providing support to those who have lost a loved one as well. So we know it's going to be phenomenal. We've had over 40 to 45 churches join up, as well as all of the services that Steve previously mentioned, joining together for one weekend. The following weekend, it's interesting because Montgomery County, Dayton will be having the same event on July 15th and 16th.
So at this event, there will be either a building or a tent called the City of Resources. And in the City of Resources will be all kinds of opportunities for people to gain information and to sign up actually that day for treatment and counseling. So it's both faith-based and it's practical in its focus to try to help people get set free from opiate addiction and heroin addiction. And we hope that the entire community will support this. Before I open to questions, I just want to say this. The magnitude of this problem is something that's going to take all of us to work together to solve. 6-7 months ago, I stood in a meeting down in Dayton with a bunch of police, first responders, et cetera. I heard the DEA, Regional Enforcement Officer, stand up and basically plead with everyone there and say, we will never, ever, ever arrest our way and sentence our way and lock up people our way to get out of this. Never. For every one we arrest, there are 3 or 4 more that pop up. The only way we address this kind of a situation is that the whole community comes together to address this in a holistic way, both with dignity and respect of the person and all of those who are involved. And that's what we're trying to do here with the Miami County Heroin Coalition. Now, I want to open it up to any questions you may have for anyone who's here today.
You know, there's several counties that are trying this redemptive approach when it comes to heroin to avoid incarceration. Is this modeled after any of those local counties in the Miami Valley?
We have, we've actually decided early on that we don't have to reinvent the wheel. So we have contacted other communities. The Fort Hamilton Hospital had started an effort. We've talked a great deal with Colerain Township. We've looked at some information that was produced by the city of Middletown with an effort that they started. And then early on, we've been in contact with the Ohio Attorney General's office through their representative, Carol Baden. She's helped to keep us apprised, at least on the surface level, of any new information that comes out and what some of the other counties are doing. But according to her, our coalition has mined some territory and moved faster than any county coalition that she's been a part of in the whole Southwest region. I don't know why that's the case, but we're excited that what we seem to be doing right now is working. We have a lot more to do, but we've made great progress in a short amount of time.
And Dayton was just voted, you know, the #1 city in the country for heroin overdoses. You know,
yes.
That's not too far from Miami County, just a county over. You know, is that, do you think, bleeding into Miami County?
Undoubtedly. I mean, I think if you talk to the law enforcement officials who are here, and they can speak up, but they will tell you that most of the heroin which is flowing into our area is coming out of Montgomery County and from the Dayton region. In fact, some people literally going down in carloads will buy their drugs and are shooting up on the way back in the car. And so there are a number of arrests along I-75 literally coming back from Dayton. So it's not as if in Miami County we have large drug dealers. I don't think that's the paradigm that we're finding through our coalition. We're finding smaller drug dealers, but most of the supply is coming in from Mexico, and through various means, it's coming into Dayton, and then it's going out from there.
And then looking ahead, I mean, what's the future goal? All those 6 things that have already been done, what's to come?
Yeah, so we're tailoring what we're doing as we're going, and our Education and Prevention Committee is more of a long-term committee. We're exploring both curriculum as well as means to educate the community about this disease, not only from what you can do about it with an addict or as a family now, but how you can prevent it from the outset. And so we're talking about getting into the schools and doing some pilot programs in schools here in Miami County, and literally moving that down to a younger age than what has been done in the past. And we have young kids who are standing there watching their parents shoot up. I can't imagine what that's like, but we have, just to give you some statistics, I mean, in 2010, there were approximately 200 emergency room visits to Upper Valley Medical Center for drug and alcohol-related situations. In 2015, there were 800. That figure has quadrupled in 5 years. We had 2 acute hepatitis C cases in 2010 in all of Miami County. In the last 2 years, we've had 15 to 20. We have an increase in sexually transmitted diseases, again attributed to this. We have more women who are pregnant, who are addicted, and their babies are being born addicted to heroin, and we're having to deal with that. So this is not just a simple addiction phenomenon. It leads to lots of other disease paradigms and issues as a public health situation for the entire county.
Can you talk a little bit about if you're getting any funding from anyone, or where your resources are coming from, and if people want to help, what can they do?
Good question. Thank you for asking that. We have tried to run a low-budget operation so far. I have been accused of begging and asking of everyone, and I pretty much have. And the good news is that many of these fine people sitting here in front of you have helped to raise money. Chief Jameson up in Piqua has raised money through various foundations to support our effort to help pay for lunches for us just to gather and to communicate. CareSource has donated all of the costs associated with printing and has offered to do even more than that. We've had private donors donate money toward the Hope Over Heroin event, which will cost $15,000 to $20,000 to do. But several thousand dollars has already been donated toward that particular effort. We have received the community has received some grant money from the state to help buy Narcan kits, and that's being facilitated through the Miami County Health Department. And those kits are being disseminated out to our first responders, to our police, as well as to our fire and EMS, so that they have Narcan kits to use. Narcan is actually available in 6 pharmacies in Miami County right now. A citizen can buy it. They can buy it without a prescription. The price varies widely, if you go from pharmacy to pharmacy, between $50 up to $150. But there are 2 pharmacies, both at Walgreens as well as CVS here in Troy, that are selling Narcan kits to the public for a family member who has someone that they think is addicted to heroin for about $50. It's not that much money to save someone's life. But thus far, only about 15 kits have been sold, and it's been available for many, many months. I think the community at large doesn't understand that it's available, that they can buy the kit, and the pharmacy has to give you instructions as to how to use it. It's part of the program. So I hope that more people will take advantage of that opportunity at some of our pharmacies. In terms of how people can give, Aaron, how can people give toward the Hope Over Heroin event?
Any local Fifth Third branch, people, organizations, corporate sponsors, we are looking for assistance to launch and to have the event and do it with excellence. But any Fifth Third location, you could go in and say you would like to donate to the Hope Over Heroin event in Miami County in July. Also, you can give online at hopeoverheroin.com.
Long term, we're looking at trying to make more efficient the delivery of our counseling and treatment services for addiction, period. And the Tri-County Board is currently in the process of considering building a new facility on 25A, not far from here, that would house a lot of the related services under one roof and make it easy for families as well as those who need counseling and addiction treatment to come to one location and get what they need. We're also looking at possibly raising money. We're trying to raise money to include some detox facilities associated with that particular center, so that we have the ability to render some sort of subacute detox treatment to addicts here in Miami County, which we currently do not have. People want to give toward the Tri-County Board for that. I'm sure that Mark McDaniel would be happy to have any donations toward that process.
Yeah, we're currently raising dollars for what probably be a 35,000 to 40,000 square foot facility that will be located on 25A. There's a lot of particulars to it that we haven't really publicly come out and spoke to a lot at this point. However, there is a fund at the Troy Foundation that will gladly accept your donations or any organization's donations towards that. We're looking at basically somewhere between 7 and 9 organizations coming together under one roof to basically redesign our service delivery system so that we can be, I guess, more customer or consumer friendly, if you will. That the front door experience will be more friendly to not only the client, the family, but also any entity that's actually referring to that front door. And we will have a wide array of services under that roof, ranging from prevention, treatment, mental health and addiction services, dentistry services, health-related services, and if we can do this correctly, our hope is to have some perhaps some 20-30-hour observation beds and perhaps some sort of a detox component to that facility. So our goal at the Tri-County Board has been to try to create more infrastructure, and as Tri-County Board, we're looking out and see all 3 counties, but the goal is to build more infrastructure to address this issue, to help other entities address this issue. What we really found, this issue has come upon us so aggressively and has become so pervasive in our communities that many of us, in many ways, we're kind of ill-equipped to deal with it. Just too much, too fast. The addictions and substance abuse services in most communities were not ready for this. Many of the services that have been available in the past, such as inpatient versus 28-day residential stays, are no longer even in existence anymore because there simply were no payers for this kind of thing. We have now we have invested just in the last 2 years over $1 million in beds. We are also opening recovery homes in the community. We have opened a men's 24/7 staffed recovery home in Sydney, and we are looking, we're reopening one here in Troy, and we are looking at Dark County as well. And basically what we're doing is Steve showed the flow chart, if you will. We're trying to build some of those building blocks that are located in that flow chart. You really need levels of care to address this issue, to get, I guess, meet people where they're at, you know, in their recovery, and that's what we're trying to do.
This is really exciting because, as I said, we don't have any, we really have no detox facilities, and our current service models, our providers are not located in one place. They're spread out, and so this should really enhance our ability to try to address this issue across our entire Miami County area. So we're probably a couple years away or so, maybe from bringing this all under one roof. But that's part of our long-term plan, again, based off of the system of care that's guiding us and that we've developed. Are there any other questions you have for any of the members up here today? Yes.
What inspired you to start this coalition? Is there some event or certain conversation, and why you?
Why me? That's a good question. Why me? I will tell you that I was invited to attend a bench bar media conference. I'm an attorney with a law firm here, Duncan & Lefevre, here in Troy. I practice a fair amount in federal court, and so I was invited by one of the federal judges to attend a bench bar media conference downtown in Dayton. I went to that and was just blown away by the statistics concerning the status of the heroin epidemic in our region. I must confess I had no clue that it was as bad as it was. However, at that meeting, I was the only person from Miami County there, and I came back and I on the way back in the car, I reflected on the fact that I've lost a cousin in the last year from drug abuse and overdose, and I almost lost a second cousin to a similar situation. And I just felt when I was coming back that, frankly, that God wanted me to do something about it. So I came back and called Matt Simmons, my good friend and brother, and said, hey, what do you think? Are you facing this? And he was like, wow, it's out of control. We called Tony Kendall, the county prosecutor, and he told us that 80 to 85% of the crime that they're prosecuting right now in Miami County is either directly or indirectly related to heroin. 80 to 85%. It was amazing to me. So then we called the sheriff's office, we called Dave Duchak, and we said, can we form something? Can we get people together? Because we really had nothing in Miami County at any grassroots level that was addressing this. We had various services all working in their own arenas, but no connections. And so we just started calling people, and within a matter of 2 or 3 weeks, it was amazing the response we got. These people up here are simply amazing. They really are. They jumped on this. They said, we're there. They came here. It wasn't about politics. It wasn't about, turf. It was nothing like that. As this is killing people, we want to get something done. And so that's the approach that we've taken. And it's been awesome. And in the process, we've learned about one another. We've learned about, you're doing this, we're doing this, we can get together and make this better, and you're doing this and you're doing that. And the judges even who have sat here have learned as they've heard about the resources and the things that are available and where we can improve. So the whole phenomenon has just been extraordinary.
Can somebody just address when you really started seeing the growth issues, like 18 months, 2 years?
I would say in the last 2 years, if you look at a curve, in terms of the various statistics I was citing earlier, in the last 2 years, you've really seen the curve even sharpen more. Started in 2010, and it has risen not on a straight hypotenuse, but certainly on a curve. It has gone up in the last 2 to 3 years precipitously. And the sad news is that we haven't seen the top of it yet. It's still going up.
Has crime gone up with this?
Yes. Crime has definitely gone up. I will allow some of my colleagues to talk about how many more cases you're seeing, the types of prosecutions you're seeing. I don't know if, Steve, you want to talk about that, or Bruce?
Okay, yeah. Predominantly what we're seeing is a lot of people having to fund their addiction. So we're seeing a lot of property crime. Retailers are suffering retail theft. We're seeing a lot of burglaries. Seems like with the cocaine epidemic, you were seeing a lot more violent crime and robbery. Typically what we're seeing is residential burglaries. A lot of guns are trafficked on the streets, Dayton. A lot of things that used to go to pawn shops now go directly to dealers. So, typically we're not seeing a large trafficking problem in Miami County as far as drugs. We have a huge abuse problem. And like I said, in the interim, we're seeing a lot of people's deaths. It's affecting, not only the addicts themselves that are suffering injury that survive their addiction, but they're going to have long-term health consequences from that. We're also seeing the family suffer. All these people belong to somebody. They care about them. And so I think in the long term, for law enforcement, what we're going to do is we're still going to go out and enforce the law. These laws are still in place. But if you have a person that wants to surrender themselves, who wants to come in and they want to seek counseling and they want to seek some type of intervention, it needs to be a safe haven for them. And that's what this is people that can come in and seek help. There's a way there. Those people that aren't seeking help and want to go out and continue to commit crimes and victimize others, then law enforcement, we're going to aggressively pursue those men.
Someone overdoses on heroin in the street, public property, they just collapse, whatever, from an overdose. Are they going to face charges, or is this going to curb that to where they will have the option to face charges or go to treatment?
Yeah, my feeling on that is that it'll go by agency by agency. My feeling is that if we are sent to you through normal channels such as an overdose, that's not something that you sought treatment. So, some of those people, they may need us to file a charge so they can get court imposed sanctions will actually get them help because they're not looking for it themselves. So sometimes we've got to intervene to get maybe sometimes jail actually saves people's lives, or it gets them into a drug court situation. But that person that wants to come in and say, I've got a problem, I'm, at bottom, and I want help, they don't need to face charges. What they need is be exposed to resources. What we don't want to do is somebody gets so desperate and there's nobody out to help them that now they're out committing crimes. You want to come in, you want to surrender yourself. You take the action to begin with, then law enforcement, as far as I can tell from based on my conversations with also the prosecutor and other agencies, is that no charges will stem from a person as long as they're seeking it.
My last question, what would you say to taxpayers who are saying, these are my taxes funding someone's room and board or jail?
What I'd say is you've got to look at the whole picture. Like I said, there's going to be healthcare situations with the abuse of this. There's, these people running around your community putting your, if they're involved in violent crime, puts you at risk of violent crime. If they're involved in property crimes, then, your home's at risk, your television, retailers, these people are working in your businesses, that type of stuff. The abuse of opiates affects everybody at some level, whether they're even aware of it or not.
I can insert and piggyback on what was being said here. The other thing too is the sheriff's department at the jail has been very open, having treatment services available in the jail facility. There is counseling for both mental health and addictions folks, but there's also an active naltrexone program, plus an active Vivitrol program for when the individuals are coming out. There's a drug court program for both the municipal and common police level. So there is an interaction between the jail, law enforcement, the court systems, and treatment providers to attempt to get folks into treatment, because we know if we don't try to do that, then it just becomes a revolving door type of a thing.
The other thing I want to just kind of throw in that's related to this topic is, under no other type of, illness or condition do we necessarily go only with a punitive route. And like Steve said early on in the opening remarks, 80 to 85% of the folks in jail have a substance-related issue. Most of the time, that's an addictive illness, and it may cause them to commit crimes, but these are our local residents, neighbors, family members, and they're entitled to every chance to try to find recovery and sustain recovery. So I think since this is a press conference, we also need to say that this is an illness. People are not really enjoying being addicted to, especially these opiates, because of the horrible withdrawal characteristics. But we need to figure out how to hold people accountable, but also how to help people. And I think to Steve's point, it's going to take a long-term, sustained effort, which we've got going in place now. The other thing I just want to say is just, Steve talked about the people up here and how, how great everybody's kind of pitched in. The progress we've made from where I sit in the last 5 months is largely responsible to Steve's just perseverance and kind of pushing the issues on this. He's really on a mission, and when you have this many stakeholders coming together, it can be kind of difficult to get any kind of, sustained progress going, because everybody's busy and doing different things. And a lot of it's attributed to Steve, in my opinion, and he's really kind of, you really can't say no to Steve in a lot of ways.
Judges do regularly, but that's... Bruce, did you have anything that you wanted to add to what Steve had said about prosecution side or the safe harbor approach?
Yeah, same thing. In Pickle, we are approaching users not necessarily criminally. It doesn't mean that they're not going to get charged, or very frequently there's associated charges besides the abuse that has led us to the encounter. But in Pickle, we've had in the last 5 days, 2 overdose deaths. And our concentration is on investigating where those drugs came from and going after the people who sold the drugs to the victims who are now deceased. And then we have had at least one successful prosecution of some people that for involuntary manslaughter that we thought were responsible for these heroin overdose deaths.
We called the first responder committee the Safe Harbor Committee intentionally, because our first responders were on board with the concept that, hey, if someone comes to us and whether police or fire, and they want help, we're going to help them. We're not going to arrest them. But if the person's not initiating it and the police are having to go out because someone has committed a crime or they've overdosed and there's drug paraphernalia there and there's drugs with them, then they're going to have to enforce the law. But at least they're trying to communicate to the community, we're here to help you. There is another alternative. We don't have to come see you. We can route you to treatment. If you want to come and ask for help, we can help you get there without arresting you, if you come to us and you take that initiative. So, any other, Dave, did you want to say anything about the jail at all, or the services that are being provided there?
Recently with the Miami County Jail, we started a medical assisted treatment program where the individuals that are in jail can apply for the program, and it's a combination of municipal court and the probation department, the sheriff's office, working to find individuals who are seeking that treatment, so that prior to being released from jail, we can put them on naltrexone, which is a form of Vivitrol. It's a pill form. We can get them on that temporarily until they can go through the mental health processes, and then be assessed and be placed in their system, and then they can look at getting the Vivitrol shot, which will then help them. It helps reduce the cravings for the opiates, and hopefully have a better chance of being successful once they get out of jail and start becoming a more productive member of society.
This is really cutting edge to actually be providing medically assisted treatment to persons while they're still in jail, and preparing to leave and to pave the way so they can continue that once they get out. So that's great work. Matt, did you want to say anything about the fire and EMS here in Troy and the work you've been doing?
Sure. I'll just add that, the one thing I haven't really heard a whole lot of is compassion. You just have to, everyone, we've been providing these services. We've had jail for a long time, but I think that when you get everybody in a room, the problems that have been solved throughout history didn't come without some sort of a risk. And so in a data-driven, especially in a government agency where you want to have data-supported action, there's not a lot of data to support some of the risks that we're willing to take to really show the compassion that we have for these people, to say, hey, they're our community, they're our brothers, our sisters, our sons, our daughters. So that's the fire side of this. Is I, as a fire chief, committed to my community that I'm going to protect and serve them. But also to my crews, I've said I'm going to protect them also. And for my crews, this isn't going into a burning building, but they suffer from a psychological effect every day they go out to these overdoses. We've had a 275% increase since 2013. So that's one of the commitments for me to be here and to be excited about the rest of the people I'm with, is saying, hey, we don't have a lot of data, but we know that whatever we've been doing hasn't been affecting the curve, that have it go the opposite way. But when we hear exciting things throughout the state, why not us? Why not us try new things, work together to do the best we can? But the first thing is just compassion. And if I could say anything of this sheet here, is just an extra step for law enforcement, everybody sitting here, to give to these overdose victims, no matter how they come through our front door or we go through their front door, that says, hey, there's help available in Miami County. We've come together to say, what can we do? So.
Thanks, Matt. Chief, the 275% increase, is that in OD overdoses, or?
That's an aggregate of our Narcan administrations. It goes hand in hand with how many patients.
Narcan is administered when someone overdoses and stops breathing.
When is the Safe Harbor program going to go into effect?
The Safe Harbor, in the sense of if someone comes and wants help, I think it's in effect now. I mean, basically, if someone comes and turns himself in and says, I want help, I want treatment, they're not going to be prosecuted. It pretty much started early on. I mean, in the January, February timeframe, it was one of the first issues we tackled, was conceptually. I mean, it's probably not a surprise to you that there are a lot of different ideas out in the community about heroin addiction or any sort of drug abuse. And one of the things that we as a community need to do is to be strategic about how we educate our community as to the reality of the situation, and then help them understand what can be done to address it. Some people think that, if you're a heroin addict and you overdose, you die. It's natural selection. They don't see the value in trying to save someone's life, trying to get them help. But as Matt just said, that's someone's son or daughter or father or mother or brother or sister, and I think every one of them is precious. Every single one. Unique, special. So.
If I can add to your comments there, Steve, because your question and the answer kind of speaks to what's been happening here locally, because at the Miami County Recovery Council, we've had a lot of people self-refer and come for help, and they're trying to get off of opiates. And, you know, for years, we've said, you know, come every day, and we'll counsel you and try to guide you through, you know, how to get help and how to begin that recovery process. The withdrawal, and this speaks to what we're trying to do at the medical supports level and trying to get some other resources in Miami County. The withdrawal is so overwhelming and just horrific for people that they're not able to do it in the outpatient setting. So now you have to try to get some responsible prescribers of Suboxone, some of the medications that will help that process so they can engage in treatment. The recovery homes that Mark talked about, so you have a controlled environment. I mean, that's why it takes a kind of systematic, holistic approach with this, or we're just going to be one step forward, two steps back in a lot of ways.
Paula, you said you had your first meeting this week in Miami County. Was that, what was the turnout?
That was last night at Fusion. This woman, Chief Jameson, and Tom. And we had about 13 people. It was small, but yeah, productive. And we're a support and advocacy group. Started in Dayton, Luray area, and she's our director, founder.
Paula, why don't you come over here and stand behind the microphone?
I'm from Troy originally, and I'm a family member impacted by this addiction. And about 2011, I started to seek support, and I found it with Lori in 2013, the latter part of 2013. And I always felt like the support, I wanted to bring the support into Miami County. I was suffering, a lot of people were suffering, we continue to suffer. There's a light at the end of the tunnel, and I hope to be that support, be that group, and bring people, encompass the families who are affected tremendously, all of us, including the addicts. All of us.
Families of Addicts has had 5,500 people attend their meetings. They're now in 5 different counties throughout this region, so they are growing.
Thank you, Steve.
It's an amazing opportunity to reach a segment of this particular problem and disease, which is often forgotten. What about the family members who are dealing with those who are addicted, and what they go through and how it rips up their families and their lives? And so this is I went to the meeting last night. I heard the stories of the people sitting around the table, and I could just tell you it was personally moving to me to hear what they have endured, what they've gone through, but also at the table were recovering addicts. And what a neat way to get everybody together around one table and to talk about how to address these issues. And people are sharing advice and what they've learned and how they've dealt with things. And it was awesome. So that was our first meeting, but it's going to grow.
I hope to be a hub of resources. I'll utilize this and my contacts to reach the families and those seeking recovery.
Are you on the resource guide or working?
Yes, we are.
You're
We
on
are.
there? Okay.
Yep.
Yep.
And why don't you talk about the rally that Families of Addicts is having?
August 28th, 2016, in Dayton. Save the date. You can find us online at foafamilies.org, and all the information's there. Come and support us.
Thanks, Paula.
And you're welcome.
She's doing a great job. She really is. It's tough plowing. It really is. But often the best things in life are never easy. They make you grow, but they're not easy. All right. Any other questions? All All right, well, thank you to all of you for coming today and for your questions, and I hope you'll support us and say good things about our efforts for the good of our whole community. So, thank you.